So about a year ago, I decided to go on a doula retreat. I really started to think about the passion that I have for mothers and babies and how important it is for women to feel empowered, especially during birth. So I went on this retreat and it was incredible, and I came back and I remember laying my head on the pillow a couple nights after the retreat and everything kind of just hitting me and coming together. I was simultaneously working at Gracious Care Recovery. I've been here for almost 4 years. And I started thinking, as a doula, we are set out to empower women and make sure that they get to make decisions and choices that are going to affect one of the most sacred moments of their life, which is carrying a new life form and giving birth. And I started to think, if women who are quote unquote normal, which we know there is no such thing as normal, but women who are normal have to fight for what they want in birth and their pregnancy, what about women who are struggling with addiction also? What about women who are afraid to disclose that they may have a problem? It all came together and it hit me that there needs to be somebody to advocate for these women. There needs to be somebody to be there to hold their hand and be their voice, because sometimes their voice may not be loud enough. And that's what Labor of Love Foundation is. It is a platform to give women a voice, to make sound decisions, sober decisions, and that is what I'm passionate about. It's a truth that a lot of women don't like to talk about. It's almost taboo, and it shouldn't be. Women who are pregnant and addicted to drugs are sometimes scared to come forward, and that's what we want to break the stigma of here at Gracious Care Recovery. We have implemented a program called Labor of Love, and it is specifically for women who are expecting and still struggling with drug addiction and alcoholism. There is such a need. In the whole United States, there, I think, is about, I recently just read a report from Georgetown University. It was just published February 2017, so this year, that said there's about 60% of treatment centers in the United States are geared towards women. They have women's programs. Only 20% of those have tracks for pregnant women. There's such a need, and I think there's several things that come into play, but one of those is resources, that there are not enough resources for women out there, and there is a stigma about what's going to happen. Is there going to be incarceration involved? We want to break that here. We want to give a path that doesn't even need to be an option any longer. So what we have implemented is a very comprehensive program for women who are expecting. They will be detoxed at a facility that we work with who is comfortable with detoxing pregnant women. They will then follow through with obstetrician and midwifery care through a partner that we could not be more thrilled and proud to be working with, because they truly respect and understand, and there's no judgment. And I think that that is a really good part of why this program is successful, because we're here with open arms to provide the care that these women need. It's an honor, and I can't believe how full circle this has all come. And at the end of the day, I am the one who feels that I have gained something to be able to work alongside these women.